So we've talked a lot in other segments about your minimally invasive spine surgery before and recovery time. I wanted to ask you a little bit about what patients can expect, particularly for those who might be coming to see you for the first time. They're walking in the door. What happens next?
Basically, you will be seen in our office. Typically, your first office visits are with me. If for some reason the schedule is heavily booked and it might be a few weeks, in our office we actually have an outlet where my nurse practitioner can see you initially, and then she can typically get you in within 48 hours to help start the process. However, the majority of patients understandably want to see me on the first visit, so we meet, and I work in tandem with my nurse practitioner and physician assistant, and essentially we gather information. So they will speak to you initially, try to get a good history, good physical examination, and then I will follow my PA and nurse practitioner through and really glean what the core symptoms are, what the core physical findings are. A lot of patients come already with their films, typically because they've been referred by their primary care doctor or their pain management doctor, but it's absolutely not required.
About how many of your patients that you see initially end up actually having surgery?
Well, ironically, a lot of patients think if you come to the surgeon, you're getting surgery. We actually operate on probably less than 50% of patients that we see from their first visit onwards. A lot of times we're able to actually make recommendations that we group under our conservative treatment category. Even with disc herniations or a bad disc or some of these other types of findings that we see, none of those are automatic surgery, and that is something I always stress to patients. We have non-operative options, and we always prefer to try those first for understandable reasons. It's the right thing to do, but B, no patient is in a hurry for surgery. So we try to exhaust the non-operative, and then if need be, that we talk about surgical treatments after that.